everyone, my name is Debbie Cearing. I've been married for 30 years and I have 3 wonderful children. I have a daughter who is 24 years old and I have a set of twins who are 21 years old, and they are all the apple of my eye. I've also been a nurse for 30 years. In those 30 years I worked in the intensive care unit for about 5 years, and the rest of the years have been in the nephrology field, mostly in the dialysis field, working with chronic patients in the acute unit and also the chronic unit. So for tonight's speech we needed to choose 2 objects that felt like represented myself. The first object that I chose was a stethoscope. And the reason I chose a stethoscope is, as with a nurse, a stethoscope we use to listen to patients' lungs and to patients' hearts. I feel that in the 30 years I've learned to become a very good listener. I can listen to the verbal communication, but also to the nonverbal communication. And when I talk about nonverbal communication, it's more when you walk into a patient's room and you ask how they're doing, you see them grimacing, but they tell you they're okay. That leads me to think to ask more questions to get them to open up to me. Same with my family. If my daughters are not talking, I usually can tell that there's something going on, and I can ask more questions to find out what's going on if they're willing to tell me what's going on with them. So that's my first object. The second object that I chose that helps to represent myself is bubbles. The reason that I chose bubbles to represent myself was, when you think of bubbles, you think of happy, you think of fun, you think of sunshine. And I feel that I'm a very positive person. I usually try to wake up every morning with a smile on my face and think it's going to be a good day. Even though some days I know that it may be difficult and it's going to be a crazy day at work, I always want to start off thinking positive, that it's going to be good. When I go into work in the mornings, I always want to start my day off with a smile, ask everyone how they're doing. I go to the patients with a smile on my face also when I walk in the rooms. I want them to know that I'm a happy person, that I want it to be a positive experience when I meet them. So those are the 2 objects that I have chosen that represent myself. I chose the stethoscope because I feel I'm a very good listener, and I also chose bubbles because of my positive attitude. So thank you for listening.